excited to welcome our second keynote speaker, Dr. Richard Jackson. A widely recognized leader in environmental health, Dr. Jackson is a professor and former chair of environmental health sciences at the Fielding School of Public Health at UCLA. As a pediatrician, Dr. Jackson has served in multiple leadership positions with the California Health Department, including in the highest position of State Health Officer. He has also worked at the federal level, serving as director of the CDC's National Center for Environmental Health and is a recipient of the highest award from the American Public Health Association. We're really excited to have Dr. Jackson here today because of his deep expertise and wealth of experiences in the realm of prevention. I can think of no one who better understands the complex relationship between our environment, broadly defined, and health outcomes. Dr. Jackson's research has shown how a host of environmental factors, from air quality to architecture and urban design, drive various health outcomes and disparities. But more than that, he has been a leader in uncovering and implementing innovative upstream approaches to designing and fostering healthy communities. So please join me in welcoming Dr. Jackson.
Thank you, Priya, and let's give another round of applause to those spectacular young people, please. You are just great. Actually, the theme of what you had to say is not dissimilar to what I'm going to say, which is it's the system, stupid. It's the way the whole thing is set up that's making us sick. Yes, it's the high fructose corn sugar, and yes, it's the Dr. Pepper, but it's the whole system behind that. $14 billion that you reference is also the amount of money every year the United States gives in subsidies to the corn, soy industries. And the one big lobbying bill that got through just in the last round was the sugar industry subsidies, which everybody wanted to get rid of, and it went through anyway. So there's a very systemic set of pressures in the direction of making people unhealthy. So what I'm going to say is, agriculture policy is health policy. Transportation policy is health policy. Housing policy, environmental policy, land use, tax policy, they're all health policy. And we got to think about the system, and it's one of the reasons our young people are so important as we think about the changes. I would argue that Prop 13 is actually a disastrous policy for the young people in this room because it makes buying a home and building equity in your careers and paying off your school loans even that much more difficult because people sit in homes. I'm the lead for the Healthy Campus on the UCLA. At UCLA, I actually live in Berkeley, but I don't tell them that. We work hard to make the campus itself healthy, but we're at war with their surrounding neighborhood. And we're living in $2 and $3 and $4 million homes that they bought for not very much 25 years ago. They pay next to nothing in taxes, but they don't want bike routes through Beverly Hills, Brentwood, or anywhere else. And so there's a real tension going on, a generational war that's not dissimilar to the generational war I experienced when I was in this building 44 years ago, because when I was a med student, this was the med student's dorm right here. The nursing dorm was over there, so there was a lot of traffic actually going back and forth in that hall there. But it was a happy time, except when I had to cross Parnassus Avenue to receive my fair share of abuse as a medical student, because that was how we trained young doctors back in the day. I hope those days are over. I love wonder. We all, on this gorgeous day, I bet half of you have visited the Embarcadero in the last 2 or 3 days, because it is so glorious to be walking along, seeing the sailboats, seeing the fresh air, seeing the jugglers, and there's good food for sale. It's really a happy place to be. And when I was a medical student, it sucked. You just did not go to the Embarcadero. It was scary, it was nervous-making, because the American Transportation Policy, the National Highway Bill, tore down the whole front of San Francisco and put up that. And it sat there for the next 40 years until, thank goodness, a Loma-created earthquake came along and made it unsafe, even more unsafe. It was very unsafe to be walking around there until midnight after being in some of the jazz clubs. But in a way, that physical environment made people unhealthy. So one of the arguments I'm going to make is how you build things can make it easier for people to be healthy, or it can make it a lot harder. The same is true if the only places you can buy food are fast food joints, and the only beverages in the vending machine are things that rot your teeth, rot your liver. So, and by the way, the other part of that is, you know what stopped the freeway from going all the way from the Bay Bridge to the Golden Gate Bridge? The military probably was in their Presidio, number one. But number two was a baby carriage brigade. It was young mothers, it was women who stopped it. And I've been doing environmental health now for about 35 years in my career. Over and over again, the big changes in environmental health almost always came from women. Women standing up and speaking about what was right in our society and for our children. Right on, yeah, absolutely. The guys were all busy, making money or going to happy hour or something, but the mothers, mothers actually see a child as not a snapshot, but a movie. And pediatricians actually were very different from internists who see the one time the patient or the emergency room doctor. We actually do a lot of thinking about the trajectory that children are on. I did my peds residency over here as well. In fact, God help me, I married a Californian, and she's one of those nurses over there. And being a Jersey guy, I really suffered for the next 40 years of marriage. I still do, because I cannot get rid of my latent bicoastiality. Because every time I'm on one coast, I want to be on the other coast, and it's very difficult for me. But we brought up our 3 kids here. So my first job was at the state health department. I actually went to CDC and did epidemiology and stuff, but came back because I wanted to do issues around farm worker health and issues around pesticide exposures to farm workers. And got a job, and the health department was in Berkeley at the time, part of it, and did a lot of investigation of illnesses, birth defects, cancer clusters, other such things, particularly in the Central Valley and heavy pesticide areas. And I would have to go to Sacramento about once a week. And if the legislature was in session, it was never very friendly, we called it Sacro-Demento. And if they weren't in session, I just had to go to meetings, and we'd be walking for blocks. It was asphalt meadows everywhere. There were isolated buildings. The trees were dying because there was not enough moisture getting through the asphalt into the ground. There was no place to eat other than sort of fast food joints and bars. Legislators are good at keeping bars in business. And the streets were all one way, high speed and scary. There was no light rail. There was no ball team or anything else. And in those days, we called it excremento. So I'm going to talk about how a place can be designed to make you unhealthy, as Sacramento was at that time, or wasn't. One of the first things I learned across the street is when a baby came in or a child came in for a physical exam, we did the height and weight. And you all know that we want to see if the child is 50th percentile for height, that they're 50th percentile for weight, roughly, plus or minus 10%. And you all know that we're seeing about 4 kids a day like this. You all know this, but I give a lot of talks to chambers of commerce and business people and others, and I gotta say, this is real clinical medicine. This is true in pediatrics and it's true in adult medicine. The avalanche of people with overweight diseases. We give all the good advice: eat healthy food, no TV in the room, no soft drinks in the house. And you know how successful we are when we sit in the clinic and just say, hey, here's what you want to do, and 2 months later the child comes back and, as you know, nothing has happened. And that's why you're here, because you have thought about ways that we can make these changes occur. But one of them is the child has no place to walk. He can't walk or bike to school. The school's way the hell outside of town. It's you really have to be taken by a vehicle to get there. Your friends are scattered all over the place. And as the young woman said, you're probably not as good at sports if you're coping with these issues as well. And so 2 months after that, you're taking $400 worth of medicines a month. And what's gone on in America is we have medicalized what I will argue are environmentally induced diseases. They're environmentally induced by removing the options for physical activity, by not having healthy food available, by having people really struggle to get the things that make it easier for them to be healthy. And the environment is rigged. against the child, it's rigged against the doctor, the nurse, and all the rest of us. One point somebody said, well, why don't those people eat better? And I remember it was around the time of the Super Bowl, and I calculated it up, and Coke and Pepsi were each spending $75,000 a second telling people to eat and drink sugar water. So this issue of medicalizing environmentally induced disease is captured in this slide. It's kind of a complicated slide, but it kind of shows that the more money a country spends, the longer people live. So Russians don't live that long. They spend about $1,500, $1,700 per person. This is sort of interesting. Here's Italy. They spend about $3,000 a person. They live to be an average of 85. So in general, health spending or medical spending correlates with how long you live, except I left a country out of this. Which one? The country that spends absolutely way and away the most and has the poorest lifespans. And David Ludwig just did an article in JAMA you may have seen where he was predicting that we will see for the 2015 data when it's finalized for American lifespans, for the first time in my lifetime, we're seeing a dip in lifespans. We begin to see it in poor white males. We're going to see it largely with stroke and a bunch of other diseases related to the issues that you're focused on today. So UCLA is very proud of itself, and there's banners everywhere, sorry UCSF, that say best in the West, because they have been rated by U.S. News and World Report to be the best hospital system in the Western United States, number 3 in the country. They probably spent $100,000 on the banners. And I'm sure if I went to the people doing this and said, we all live 30 years longer than our great-grandparents did 100, 125 years ago, I think, oh yeah, we're really a good hospital. And the truth is, only 5 of the years increase in lifespan came from medical care. The other 25 years came from the 2 big I's. Number 1, I say this as a pediatrician, is immunization. I number 2 is infrastructure. It's the physical environment things that we do. Clean water, clean food, safer workplaces, safer vehicles, better housing, heating of homes and air conditioning where it's hot. Those things have really added to our lifespan. And people take it for granted. Oh, it's supposed to be that way. Those were health interventions. Robbie Pearl did this article in that liberal magazine called Forbes. It's actually a very conservative business magazine. Robbie Pearl is the head doc, or was at Permanente Medical Group. And he said, how do we make things better for patients and doctors? Well, they're all worried about life choices. And the fact that what's really going on is the medical system is helpless to turn this around, which is why this meeting is so important. Because the medical system's not going to deal with this. So after doing this work at the health department, and I ended up both head of infectious disease control and toxic stuff in California, I was offered a job at CDC. And it was the head of the National Center for Environmental Health, the highest health and environment job in the country. It was really interesting. So I remember announcing to my kids who were in middle school in Berkeley, guess what? We're going to move to Atlanta. We don't want to go, Dad. No, and you can each get your own bedroom, because on a government salary, even with 2 of us working, we couldn't afford 3 bedrooms for each of bedroom for each of our 3 boys. And we don't want to go. Oh, no, I'll get you a dog. You can have a dog. So finally, of course, it's like being offered a job at the Supreme Court. You have to go if you get offered the job. So off we went to Atlanta. We arrived in September of '94, and it's 94 degrees and 94% humidity. And the kids are completely convinced Dad is the biggest fool in the whole world. It was not an easy stretch, but it was a big house for half as much money as we spent at Berkeley. So I loved the job. I had to focus on childhood lead poisoning, atoms of lead, molecules of chemicals, endocrine disrupting chemicals. You've probably talked about this a fair amount in terms of the obesity epidemic. If not, we could do it in the Q&A. I focused on big things like the oversight of the destruction of the chemical weapons of the United States. We had more chemical weapons just in Anniston, Alabama to kill every mammal on the face of the earth, and the United States Army was destroying it. Somebody had to watch them do it. We looked at cruise ships, we looked at nuclear sites. We had a dozen nuclear sites around the United States. We had to do oversight of health effects. It was an absolutely fascinating job. And one day there was a meeting held in the headquarters, and I was driving over to the CDC headquarters on Buford Highway in Atlanta, Georgia. And you've all driven on a state highway like this. It's 7 lanes wide, 3 in high speed this way, 3 high speed that way, with a suicide lane in the middle. And it's lined on both sides by the homes of the poor. You know, if you've got money, you're not going to live in a street like this. And it's immigrants, largely African American. And I look over to the side of the road. I'm rushing to get there. It's 94 degrees, 94% humidity. And there's an elderly woman walking along. And she's bent over with osteoporosis. And she's got a plastic shopping bag, one in each hand. And she has red hair, and she looks like my mother. And I want to stop and give her a ride, and I don't do it. And I go to my meeting, we're talking about all these big issues because we're doing the strategy for CDC in the 21st century. All I can think about is that poor woman. And if she collapses and dies, the medical system will say, heat stroke. And it won't say, heat island effects, asphalt, no trees, no public transportation. She's killed by a truck going by. The cause of death will be motor vehicle trauma, and it won't be absence of sidewalks, absence of public transportation, poor urban planning, failed political leadership, racism. And so I went back and I called my friend Howie and I said, Howie, I think we've been focused on the wrong stuff in environmental health. We're focused on stuff far away from people's lives. What really matters to people is where they live, where their kids live, where their elderly parents live. That's the thing that really influences us the most. We haven't paid any attention to it because after World War II, everybody got in a car, drove away from the cities, and we figured cars would solve all of our problems, when in fact the opposite has happened. Skip these. The economic engine for the United States in the second half of the 20th century was cars. 25% of the entire GDP of the United States went to buying cars, paying for cars, putting gasoline in, servicing cars, insuring them, fixing up the wrecks. Cars aren't especially good for you. Sitting in a car raises your blood pressure, raises your cholesterol, raises your risk of having a heart attack. You have a 1% chance of dying in a car crash in the United States. If I ask somebody from Walnut Creek, what are you more likely to die in a pool of blood, an urbanite or a suburbanite? They say, oh, that urbanite, you know, it's dangerous in Oakland. And the truth is, you're more likely to die in a pool of blood if you're driving, because it's a larger risk than crime from car crashes. By the way, every 79 miles, and I met a nice lady from Sacramento, which is 79 miles from the bridge, you buy a 1 in a million chance for death. So it's driving to LA, I don't drive, I fly, but driving to LA, I buy 5 lottery tickets each trip. So one of the things I learned in pediatrics, you know, we took care of really sick kids all the time. But the one thing we pediatricians were afraid of more than anything, especially with our own kids and family, was trauma, because it was the one way a child would go from perfectly healthy to disastrous and end stage. The leading cause of death, virtually for the entire first 34 years of life, is car crashes. Everybody my age has lost a friend to a car crash in their lives. So cars, you know, they bring us a lot of good, but they do a lot of things to us as well. Well, to meet the needs of cars, we tore out as many 60,000 square miles of trees to just pave over the United States. That's the equivalent area of the state of Georgia. We then took the finest farmland, and this really relates to your discussion today. We put the finest farmland on your houses and subdivision. Alameda County, San Leandro, that whole area were truck farms. Santa Clara produced the finest tree fruit in the entire world. The leading agricultural county in the United States of America at the end of World War II was, guess where? Los Angeles, California. We planted houses all across that. And this is still going on, and it's happening in the Central Valley now, where we're losing. We just cannot continue to destroy the first-class farmland. I was in Salinas a couple months ago, and it breaks your heart to see that spectacular farmland being paved over mile after mile. And they're sticking great big gigantic schools with minimum acreage standards for parking and everything else on more and more farmland. Instead of really, why should we be building schools downtown where kids actually live so they don't have to be in the car all the time? In fact, you all know that the worst car crashes are, or at least worst driving, are around schools. We built 3 million of these garages in the United States every year before the big crash. We have to attach human habitation to it, but what we're really building is homes for garages that we stick people into as well. We built, this is in Florida. Imagine you got a new baby, you're struggling to pull your money together, you buy a house, it's in a subdivision in Florida, and you live in this house, and you make friends. You don't know anybody, you make friends with the person across the fence, you say, hey, let's get together and we'll have a Memorial Day party, we'll have a cookout, I'll bring the potato salad, but you really don't want to throw the baby over the fence. It's just a little high. So, man, I got other things to bring in the ice chest, so I think I'll drive over. Well, you really don't know the way because you're new there, so you go to Google Maps and you figure out how to get there. It's 7 miles away by car, 17 minutes. Now, it sounds hilarious, right? Underneath the humor here is the fundamental reality that we have built America to meet the needs of cars, people that sell cars, and the whole automotive industry and the fossil fuel industry. And we don't build America for the needs of people, of family. 1/3 everybody in this country, 1/3 does not drive. So you're essentially the most disenfranchised people of all if you don't drive in the US. You're too old, too young, some disability, you're too poor. It makes it even worse to be poor. It's a tough country to live in other parts of the world and actually have a reasonable quality of life and be poor. You do not have a good quality of life in the United States if you're poor, guaranteed. The other second-class citizen group is pedestrians. So this is, again, looks like a joke, but the truth is because the homeowner's got to put in a sidewalk, city doesn't do it. City puts in roads, but sidewalks, that's silly. Who needs sidewalks? We do these things that are essentially absurd. And we create another secondary class of citizens, people that are in war. Well, I actually grew up in Jersey in 1955 was the opening of Disneyland. And every kid in America wanted to see the opening of Disneyland. And some of the older folks in the room probably remember watching it. And the thing is, the camera's panned on the Magic Mountain at Disneyland. You can see Tinkerbell flying around, and the camera backs up, and oh, it's really cool. The camera backs up, and over on the right side you can see Highway 5 in Anaheim. It's a freeway. Whoa, roads are free. And it's got 5 cars on it. So everybody in America decided the roads were empty and they're all free, we're going to move to California, and the state went from 10 million people to almost 40 million people in the last 50 years. So my wife finally gave up on LA, she moved north to San Francisco, to Berkeley about 5 years ago, because you can't get anywhere, because everything is so gridlocked at this point. One of the things I teach my students at UCLA, this is really important to the conversation the young people were having. The built environment is social policy in concrete. Our social policy is, we don't want any black people in the North Atlanta. We won't run MARTA. We won't run transportation up there. We'll just have people come in by highway. And I was at meetings where people would say, we don't want the transit system coming to Northwest Atlanta because it brings in the wrong element. You know what that's code for. And so they're now at 23 lanes, and it's stopped all the time because they don't believe in transit. That's a Democratic conspiracy by Bernie Sanders or something. I don't know. But it doesn't work. So we'll talk a little bit about food, and I'm going to talk about some solutions as well. I won't take you through the maps, but I'll tell you, I was at CDC when the chronic disease people walked in and showed at the director's office about 1996. Take a look at these maps. These are amazing. And it really was remarkable. You know that it raises your risk factor, the obesity raises your risk factors of diabetes, and these are the diabetes maps until 2007. I apologize, you all knew this, but I was stunned when the NHANES data came out and showed I kind of knew we'd be at 12% diabetes. I had no idea we were at 36% pre-diabetes. It just was stunning to me. And I think a lot of docs were, even though we're cynical, we're a little surprised. You know the implications for this. I won't start on this, but I remember going to the children's diabetes clinic right across the street. It was all children with insulin-dependent juvenile diabetes. I never saw a child with adult onset diabetes. That's what we call it. And now, of course, half the children in the diabetes clinic. And talk about an assault on the youth. I mean, if an enemy of this country came in and gave half of our kids, or at least, gave this prevalence of disease in our children, we'd go to war over it. I wrote, I'll skip this, but basically this is a paper I wrote about why agriculture policy is health policy. It was published. And one of the things I did when I was the Secret Service man guarding my boss in Sacramento, it's a joke, I really wasn't. This was an event on the west steps of the Capitol, and it was about farm supports, farm subsidies. What's that got to do with what you do? Remember the $14 billion for corn, soy, and things that are bad for us? How much money goes into subsidize artichokes, avocados, asparagus, the things that are good for us? Nothing. Nothing. So we subsidize what's bad for us, and we basically make the things that are good for us more expensive. So food that is good for us is twice as expensive as it was in 1985. And food that's bad for us is half as expensive. So when people are opting to buy the Oreos and the Twinkies and the Ho-Ho Hostess things, they're actually making a reasonable economic decision in the short term. I don't think, perhaps, let me know if everybody knows this one, but it just blew my mind. CDC does an actual physical exam of about 5,000 to 7,000 people per year. Full interview, the whole deal. You go through these vans and your eye tests and urine and everything else. And this is called NHANES. It's the gold standard for the snapshot of American health. So we're going to compare the snapshot of American health, people ages 46 to 64, 20 years ago and just recently. How many people, what do you think? Do you think excellent health went up or down? Down. I didn't think it would go down that much. People say I'm in excellent health, they're usually right. And to see that kind of drop from 1 in 3 of Americans to 1 in 8 Americans saying I'm in excellent health. Can you get around? You need help? Relative increase of 5%. This blew my mind. These people are only in their 50s. Need a wheelchair or a cane? More than a doubling. 7% of the people in the prime earning years of life needing help getting around. You know what happened to obesity and smoking? Did you know this next slide? We physicians have been wagging our finger at people for the last 30 years saying, you gotta walk, you gotta exercise, you gotta be active. Look what a great job we've done. We failed. And so this is the rest of my talk, is how do we make being active sort of the default activity rather than the gotta go out of your way to do an activity. I'm gonna go quickly through this because you don't focus on climate change, but boy, I spent a lot of time thinking about it. When I was born, the planet's CO2 level in the atmosphere was 300 parts per million. It's now 400 parts per million. And Maeve, where are you? Where's Maeve? You were talking earlier. My granddaughter was born when the planet was 400 parts. I was born when it was 300 parts per million. It's now 400. My granddaughter Maeve was born when it's 400. And when she's my age, it could be 500. And the implications for the temperature of the planet are just staggering. This is the real temperature of the ocean and the atmosphere on planet Earth over the last 130 years. It's been going up a couple of degrees. This slide is stunning. The year looks like this as well. So, see these spots that are, this means it's a whole lot hotter in Alaska and a whole lot hotter in Siberia and Eastern Europe. I won't go into that right now, but anybody know what this is? It's the North Atlantic, right? It's cold. Everything else is hot, and the North Atlantic's cold. That Gulf Stream's supposed to go up there and carry warm water. What's going on? Greenland is pouring off the equivalent of 4 Mississippi rivers a day of water that's been pure ice for the last 200,000 years. So much water is going in the North Atlantic that is changing the complexion of the North Atlantic and the temperature of the North Atlantic. This is relevant to anybody that's interested in food or interested in our future. 2 years ago, the international agencies were predicting sea level would go up 0.5 to 1 meter a year, about this much. Just came out with the melting in Antarctica, big article in Nature. It's wrong. Every single prediction about climate change has been wrong because it's been going much faster than anybody ever said was going to happen. So it's now going to be 1 to 2 meters. So you can imagine what happens to South Jersey and Florida if you're at 2 meters. Bangladesh, with 170 million people, are going to need a new place to live. So even though we find what's going on in Syria absolutely terrifying with 500,000 refugees, it could well be 1,000 times that number with sea level rise. So everything else is like, oh my God. Energy policy is health policy. Tax policy and subsidy policy is health policy. All the governments in the world are now subsidizing the extraction and burning of fossil fuels to the tune of $5.25 trillion a year. By the way, the whole U.S. GDP is about 17 trillion. So the equivalent of 1/3 of the entire U.S. GDP is going to subsidizing the extraction and burning of fossil fuels. This is the International Monetary Fund. These are the most conservative economists in the world saying this is what's going on. It's more money than all the money we put into all the medical care in the whole world is going to subsidize fossil fuel extraction. Let's skip these two. All right, some big things on the horizon. One is, everybody knows the population's number of elderly in our population is going up. I put the slide out of order. This is the Academy of Pediatrics statement on why children need to grow up in environments where they can be physically active. And they were as obsessed with the idea of children's autonomy and intellectual and personal autonomy as it was to the need to be physically active and burn off additional calories. Tony Eichen from the California Endowment was on this committee for the Institute of Medicine. They came up with 24 ways to turn around the obesity epidemic, and guess what number one piece of advice was? Change how we're building our cities and neighborhoods. Communities, transportation officials, planners, health professionals should make promotion of physical activity a priority by increasing access to places and opportunities for this activity. So I'm very active around the Los Angeles River. The LA River goes through the poorest, most obese, least active, least green environments in all of Los Angeles. And a lot of the poor people live down along the LA River, which is 50 miles that ought to be a totally linear green park, are bicycling on the most dangerous roadways because they're too poor to own cars, to get to work miles away, sometimes in the dark, in the wintertime, to get back and forth to work. This should have gone with the elderly slide. For elderly, the thing that we folks have to do is just be active. Being active for every day for a year, not a whole lot of walking, but a fair amount. Your brain size increases. At my age, if you're not active, your brain size decreases. Brain size actually correlates with mental functioning. Elderly that have money, guess where they want to live? Yeah, they might want to live in some fancy suburb way far away from people. There's one out here, Blackhawk. But a lot of us want to live in a university town. We want to live in a place that's got a lot of culture, where I can be active, that has interesting restaurants, that has things to do. And so more and more the university towns are welcoming older folks to move in there. And there's two reasons, one of which is we're going to die sooner than the rest of you. And the universities want nice big transfer on death charitable donation. I get calls every week from this place asking me to donate. They don't know I only worked in public health and don't have any money. But there are now more millennials in the workplace than there are boomers, which is a big shift that just happened in the last year. And it's going to change the thrust of this country. What do millennials, what do you want in the neighborhood? Ease of commute, transit access, walk to amenity. Totally different from what the boomers wanted. We all sort of bought off of the American dream. Did you ever hear, one time I gave a talk in Honolulu in front of the city council and everybody else, because Honolulu needed to put in a light rail along the Waikiki and up over the mountain and stuff. And the Board of Commissioners was there, and I was being set up. I didn't know it. All of a sudden, this guy throws books on the table. He starts screaming, "Dr. Jackson, you're trying to kill the American dream!" Radio, TV's on me. George Carlin called it the American dream because you have to be asleep to believe it. Well, it was the only thing that got me out of that one. It was the only thing on NPR the next day, too. So people say, I don't like density. I don't want to be in environments where I have to walk and exercise. And if you want to make change, you've got to do exactly what these young people did, which is it comes out of culture. It comes out of fun. It comes out of the enjoyment of being alive and really revitalized. This is Ciclavia in Los Angeles, where you close down whole boulevards in the city. I remember when they closed down Wilshire Boulevard, and the next day the news, they were interviewing people, and they said, well, how'd you like biking Wilshire Boulevard? They said, oh, I didn't know people were so nice. I didn't know the buildings were so interesting. I didn't know I could get downtown faster on a bike than I could in a car. And so really, the bicycle culture, which San Francisco has been a major leader on, is a very important way to go. I love this one. They can actually track bicycle traffic by a movement of cell phones in neighborhoods. And one of the things this shows is where do you see the most bicycle traffic is around water. People want to be near water. It goes back to the LA River. I'm trying to get Berkeley to tear out the street over the Strawberry Creek, because at one time Strawberry Creek actually had salmon going all the way up to the Berkeley campus. They'd have to tear out part of Center Street, but it's okay. I'll come back to that. Minneapolis, most bicycle city in the country, they actually plow the bike routes before they plow the streets. And again, you can see people wanting to bike near the water. We'll skip this one. Anybody know the difference between the rest of the country is showing declines in lifespan? Guess where is not showing a decline in lifespan? The Big Apple. New York City has done a lot around smoking, around food issues, and all the new buildings are expected to have stairways. When I was in this building, I'd take the elevator because the stairways smelled bad and were never cleaned, and the doors weighed about 80 pounds to open if you're carrying books. It was a nuisance. All the buildings have to have pleasant, attractive stairways. The 10th most visited tourist destination in the whole world is a 20-block hunk of old railway, 3 stories above the lower west side of Manhattan. Everybody shows up just to go for a walk without having to worry about cars the whole time. That's called the High Line, but I was with my 2-year-old grandchild, and I couldn't have been happier, and he could not have been happier anywhere else in the world that day. Transportation works. And damn it, why wasn't the N-Judah working? I came out and I had to get on a bus at Van Ness because the N-Judah stopped, and I used to take it all the time. But transit really does work, and it saves a lot of energy. They put transit into Charlotte, North Carolina, went back for a completely different reason in the survey, and discovered the people using light rail weighed 6.5 pounds less than the people who weren't using light rail, and they're more likely to meet the Surgeon General's guidelines for physical activity. I'm being LA focused, but we've just passed $30 billion. In 2008, half-cent sales tax, $30 billion for putting subways into LA because it doesn't work anymore and the city's going to die unless it has subways. This is the one that's proposed to go out by UCLA. One of the stops on one of the lines used to be a awful four-way set of asphalt parking lots, cement parking lots. And over time, the Latino population, the mariachi bands would go down and play there, and the food trucks came, and it became Mariachi Plaza, and then dads were going to throw their daughter the entry birthday party, would come down and hire the mariachi bands. If you had a wedding come, you'd hire the mariachi bands. Well, pretty soon all of LA is showing up and smiling and laughing and being at Mariachi Plaza. And it was really very successful. So when Metro decided they're going to put in the subway, they'll run it through Mariachi Plaza because everybody wanted to be there, but they had to scrape it all off. And they were going to put in this band shell and surround the whole thing with high-priced housing for people that already had cars and didn't really need the subway. But they would maintain the cultural feeling of the place by having a parking structure that had Mariachi Plaza written along the top of it. Sounds like a joke, but where I'm going with this is leadership's got to be top-down and it's also got to be bottom-up. And the community was furious with this and killed it. I'll skip this, I'm out of time. This is the Surgeon General saying everybody's got to walk, and his announcement on that. I'm out of time here. So I'm being wonky now. Remember top-down? Caltrans is pretty important, right? Everybody knows what Caltrans is. Those two guys that sleep in the orange truck. No. Traditionally, transportation agencies thought their job was to move people and vehicles and goods quickly and safely. Governor Brown rejected that and said, no, come up with really what you're about. And he refused several of their strategic plans, but I love this one. They changed it from just safety to safety and health. So now roads have to be about moving people and being physically active rather than, and a lot had to do with the cultural issues. Let's skip these. He began to force the Caltrans to divest the state roads in downtown areas. Remember I talked about the state road? The community really has no control over it. They're being relinquished back to the communities. So here's a couple of examples of communities that have been able to take back their state roads and really create places that are a heart for the city. Not perfect yet. Sorry. This is really big. You don't know this, but the general plan for every town is built according to a general plan. And permits are, every city, every county, and the state has a general plan. It's always been about money and transportation and open space and noise and housing. It never spoke about health, equity, and community development because that was optional. Water and resiliency. Here's the new general plan, largely written by a pediatrician who graduated this place, not me. And every chapter, every page says what you're building has to be healthy, equitable, resilient, and economically vibrant. This is a big shift, and policy does matter. I'm going to skip these, I'm sorry, I don't have time. Here's two, somebody says, well, I don't want to be conservative with energy. I don't want to reduce my carbon footprint. Here's two cities, same population, 5.25 million. One is 30 times bigger than the other in footprint. One has 10 times the carbon footprint as the other. If I ask the average young person in this room, would you rather live in Atlanta or Barcelona? I think I know the answer. So, next to last slide. Sacramento decided that it was really bad to have all these open parking lots and began to really incentivize the building of buildings, and a lot of the buildings had to be housing that held people through the day. Even the state buildings and all the hotels now have 3 and 4 floors of resident housing, because there's nothing worse than a city that dies at night and dies on the weekends. They brought in, when I was health officer, I pushed very hard for both a penny and teaspoon tax on sugar and sodas. I didn't get that one. I also pushed for the farmers markets to be able to use the, we call them food stamps and SNAP, and then to get farmers markets, because the police departments were opposed to farmers markets because you needed a parade permit to get farmers markets. So we've been able to go around some of that stuff. Surfing parking lot's been hidden. I love this. This is the one next to my offices in Sacramento. Can you imagine a parking lot that was so beautifully done that people stopped and took pictures of it? The Aztec dial and sun here. But where I'm going with this is the importance of culture, the importance of art as we think about making lives meaningful and enjoyable for people. It's actually a more lively place. It has more young people than San Francisco, I think, because most young people, unless they work for Google, can't afford to live in this place anymore. So it's really booming up there because that's where people can afford to live. That's my PBS series, and I'll talk about that later. But put people first. Put children and the elderly first. Build with a view towards our future energy, tax, and other policies. And with that, I'll stop. And thank you very, very much.
Thank you. We have time for a few questions.
Hi, I had a question regarding joint use programs. I was seeing if you promote joint use programs as well as using parks for economic stability for, putting in a park increases the property value. Have you ever thought of that?
Hold your mic up. Go ahead. The property value is what?
Like putting in parks in communities and how it increases property value in communities.
Nationally, the presence of a park is worth about $25,000 per block. So if you're near the park, your house is worth about $100,000 more. Block away, it's $75,000 more, $50,000, $25,000. Joint use programs, it's still a battle. A lot of schools are still keeping the fences locked. I think it's changing. You probably know more about this one than I do. This is joint use of school property during off hours and the legal issues for that. The greening of the LA River is going to cost about, my guess is it's about $5.1 billion, which sounds like a lot. It's going to happen. The mayor's committed to it. The Army Corps of Engineers is committed to it. Los Angeles is committed to it. Big donors are committed to it. It's going to happen. My big fear is it's going to gentrify and make neighborhoods that were affordable for poor people very difficult to use. On the other hand, folks there have a right to live near a green space where they can bike, where they can walk, where they can get downtown, and where they can have recreational space. And so some really interesting design about using old utility rights of way, current utility, and beginning to create exercise space in areas where we never had it before. But there is going to have to be a certain amount of condemnation. One piece of good news is this is California, and we always have disasters, fires, and earthquakes. So we have to figure out what we're going to do after the next big fire and earthquake and save a bunch of this green space and places that people need. That sounds cynical, but actually Burnham had a plan for San Francisco that he wrote in 1886 before the earthquake 20 years later, and which was actually implemented after the earthquake, some of it.
Hi, very exciting. So many different aspects to think about. I'm curious.
Say your name first.
Hi, I'm Gabby. I'm a personal trainer actually, and I'm really interested in the exercise as medicine solution to the obesity problem. I'm wondering to what degree can physicians or those in the medical community help to really kind of develop or strengthen the message about exercise as medicine, and how do we increase compliance?
You know this better than I. 20 years ago, I used to have a slide that showed a prescription saying, take this once a day and exercise, and all the rest. Washoe County near Reno, the county government, actually, this is very interesting. They give you an additional $100 in your paycheck every month, but if you don't swipe your card at an exercise facility, you have to give back the $100. And it sounds odd. You would think, well, you get the bonus if you do it. The truth is, people hate giving back money 5 times as much. And this is real data. People hate losing money 5 times as much as they like winning money. And so giving that painful incentive to get people to do it. In LA, we have a BFIT program that we're particularly focused on our high absentee employees. It turns out our high absentee employees usually have this mixture of chronic diseases. And making the gymnasia, which are really paid for by the students and student fees, available to our staff has been a legal battle. We're there, we're doing it now. And the staff that do it love it, and I'm not exaggerating. They're very proud and a sense of accomplishment and identity that's been very positive. I actually think that we've been too weak on emphasizing the physical activity and maybe too strong on talking about fat. In fact, maybe we need to substitute muscle for fat in a lot of our discussion.
Please join me in thanking Dr. Jackson.